Hi to everyone, welcome back. Today we are going to speak about NCLEX-RN 2026 update. So we all know that some changes has happened. So what every nursing student needs to know? Actually, the National Council of State Board of Nursing has released the new 2026 NCLEX-RN Test Plan. So which is going to be effective from April 1st, 2026 through March 31st, 2029. The good news, there are no major format changes to the exam. What's staying the same? Okay, we can see that the next generation NCLEX remains fully integrated. Clinical judgment continues to be heavily tested. Exam length remains 85 to 150 questions. Testing time remains 5 hours. Computerized adaptive testing remains unchanged. Current NCLEX questions, types, and scoring methods remains the same. What's new for 2026? Here, increased emphasis on health equity. So, the nurses are expected to provide unbiased, equitable care regardless of a patient's gender identity, sexual orientation, ethnicity, or background. The next, greater focus on patient dignity and privacy. So the nurses are expected questions that reinforce respectful, patient-centered care through the lifespan and updated safety categories. So the safety and infection control is now called safety and infection prevention and control. The next, internal monitoring devices. Candidates should understand nursing responsibility related to devices such as intracranial pressure, which called ICP monitors, intrauterine pressure catheter, IUPC, other internal monitoring equipment. So now we are going to see some study tips for 2026. Don't focus on memorization alone. This is what I wanted to highlight here. The NCLEX continues to prioritize, recognize cues, analyzing patients' data, prioritizing care, making safe clinical decisions, and evaluating outcomes. So here, the bottom lines, the NCLEX-RN 2026 is an update, not a complete overhaul. If you are already preparing with NGN style case studies and clinical judgment questions, you are on the right track. That's it, guys, for today's video. Please stay tuned and subscribe and like and share. Thank you. See you soon.